Okay, welcome back. Video number 2 of lifespan development. So initially here we're going to talk about two age groups. One is toddlers, which is ages 1 to 2, and the next is preschoolers, which is ages 3 to 5. So here we have our vital sign chart again, and one very important thing to keep in mind is that as far as vital signs go, as children age, their respiratory and pulse rates will go down, their blood pressure will rise through adolescence, and then the blood pressure will level off to be what we normally would consider an adult type blood pressure. One of the things to look at with this is if you can remember the newborn or the neonate with the respiratory rate of 30 to 60, a pulse rate of 90 to 205, then you will be able to kind of remember and see how those change. It changes very little from neonate to infant. It does change considerably between infant and toddler, and then only slightly between toddler and preschooler. So as we look at this toddler and preschooler age group, we see the cardiovascular changes are very similar to an adult, but they lack well-developed lung musculature. So they still may have pulmonary issues through disease processes or injury. With their immune system, they have passive immunity from the mother that will begin to go away. So from the infant to the toddler, that passive immunity will begin to go away. This is about the age that these children begin to have the common cold and upper respiratory infections that tend to be common with this age group. The child will also develop their own acquired immunity during this time as well. The neuromuscular system is also developing during this time. Development of gross and fine motor skills will begin with walking, running, jumping, playing catch. And that skill of walking or running, stepping over objects, stepping up on curbs, those sort of things are important. Jumping, such as jumping rope, and that eye-foot, eye-hand coordination with playing catch are also very important. A preschooler's brain will weigh about 90% of the final adult weight, and muscle mass and bone density will also increase. This age group begins to develop control of bladder and bowel functions. A toddler can feel their bladder that is full by 12 to 15 months of age. By 18 months, they have enough muscle control to delay that excretion for a short period of time. The teething process also begins. This may be painful and include a fever. Sensory development makes tickling fun. In this age group, separation anxiety peaks. So as we look at these various psychosocial changes, this one is very important because as you try to treat a toddler, they will not want to leave their parent, grandparent, whoever their major caretakers are, and go with a stranger. Their language also develops during this time, and interaction with other children and adults result in learning control, obedience, and competitiveness. They will model behavior that they see in life, such as on television or on the internet, and they begin to recognize sexual differences in role models and siblings. So here's some important tips for the paramedic for this age group. Include the parent or caregiver in your assessment and treatment. Position yourself at eye level with the child. Explain what you are going to do before you do it. That's very important. And save anything painful or uncomfortable for the last part of what you're going to do to that patient. Their personality style becomes a reflection of their parents. So they could take on one of three types of personality styles. The authoritarian, which expects complete obedience. The authoritative, which balances authority with freedom. And the permissive, which does not impose rules. In this personality style, parents tolerate all behaviors, including socially unacceptable behaviors. So now we'll move into school-age children. Definitely they have physical changes. This is age 6 through 12. They'll tend to gain 5 to 7 pounds of weight each year. They'll grow about 2 inches each year. This is the age group that their permanent teeth come in. And in some, puberty may start at 10 years or younger. So again, we go back to look at our vital sign chart, and we see where we've come from the neonate, for example, with the respiratory rates from 30 to 60, pulse rates from 90 to 205, and in the school age from 6 to 12, we are very close to what we would consider adult vital signs, with respiratory rates from 18 to 25 and pulse rates from 60 to 100. And you'll notice that blood pressures become more similar, very similar to adult type blood pressures. So this age group also changes psychosocially, as every age group does. They'll learn various types of reasoning. Some categories you may encounter are pre-conventional, which means they avoid punishment. They know when they have done something wrong, and they know that it's wrong, and they try to figure out how to avoid punishment for that. Conventional reasoning means that they like to obtain approval from peers. So peer pressure becomes very important during this age as well. And then post-conventional reasoning involves decisions made based on their own conscience. So these are things that typically have been taught by caregivers, parents, and other important people in the child's life. Also, their self-concept and self-esteem begins to develop at this time. So some tips for paramedics for this age group: use the same techniques as you would for preschoolers. Positioning, get on the level of the patient. Explain things to them before you do it. And when possible, give them choices. For example, if you're going to give an injection or start an IV, ask them if they would like to have it in the left arm or the right arm. This gives them a little bit of choice in what's going on. Trust is huge with this age group. They begin to develop trust in their friends, in their parents, their caregivers. And so if you can develop trust with this age group, that will take you a long way. But also be direct, be assertive, and be open with them. So moving into adolescents or teenagers, this age group is from 13 to 18. They have a rapid 2 to 3 year growth spurt, and that can take place anywhere during this age range, depending on the individual. Their vital signs begin to level off, as we see in our vital sign chart. With the adolescent, their vital signs are almost identical to what we would consider adult vital signs, with their respiratory rates being from 12 to 20, pulse rate 60 to 100, and you see the blood pressures there: systolic 110 to 131, with diastolic 64 to 83. Physical changes for this age group are very stark and very radical. They have reproductive changes. Their secondary sex characteristics began to appear, which is going to be enlargement of external sex organs. Pubic hair, axillary hair begin to appear, and their voices begin to change at this point. Girls will start menstruation if they haven't started prior to this. And this beginning of the menstrual cycle is called menarche, but it also may begin earlier. They also begin hormone secretion during this time. For girls, they will secrete follicle-stimulating hormone, or FSH, luteinizing hormone, or referred to as LH, and also estrogen and progesterone. Boys will begin to secrete gonadotropin and testosterone. This hormone secretion in both boys and girls can be the cause of acne to develop as well. So one of the types of psychosocial changes that start with this age group is maybe sometimes family conflict. This age group is wanting to take more and more, or be more and more independent. They want their privacy. They're very self-conscious. They can be very rebellious. Peer pressure is a very strong part of their social atmosphere, and they can also participate in very self-destructive behavior. So some tips for paramedics for this age group is to provide privacy and respect. And this doesn't just necessarily mean, as with all patients, you're going to respect their HIPAA guidelines, HIPAA rules, but this also means just treating them more like you would adults, in respecting them, asking them when possible to give them some choices, but also because they are very aware of their body changes and their physical changes. Make sure they're in private if you have to undress someone, and then also, if possible, try to have someone of the same sex as the patient there as well in attendance. Also, speak with parents separately from the patient, if possible. Sometimes the patient may not want to say things that they may not want to say things they don't want the parent to hear. You may also find some information out from the parents or guardians that the patient may not want to tell you. For our purposes, early adults are going to be age 19 to 40. Their vital signs will remain constant during this point in time. However, their optimal body function is between the ages of 19 and 25. Some psychosocial changes that take place during this time are that work and family become their main focus. During this age group, they develop the need to settle down, so to speak, and have a family. They want to seek and find love, and they have that desire to have children. This is typically one of the most stable periods of a person's life. The age group we call middle adults is from age 41 to 60. Oftentimes during this age group is when we begin seeing vision and hearing losses. Cardiovascular disease tends to pop up if the person hasn't been taking care of themselves or eating a proper diet. The body's metabolism will also begin to slow down, which may increase weight gain. Also, cancer rates can increase during this time, and it's also the time that women begin menopause. Typically, people in this age group are very focused on meeting life goals. Many of them have their children, and at some point in time will have grandchildren. Their children began going to college and going off on their own and getting jobs. They'll have the empty nest syndrome, which is a feeling of, what do I do? Because much of their life has been, over the past 18 to 20 years, has been devoted to their children. So all of a sudden now they may not have children at home. And they also begin to have financial concerns related to their retirement.